Welcome to the Real News Network. I'm Paul Jay. We're at the People's Summit in Chicago. And the People's Summit is the driving force of the summit has been the National Nurses Union. And they've been also leading the fight in California for what they're calling Healthy California. It's essentially a California Medicare for all, or a government health insurance plan where everybody's in and nobody's out. And now joining me is one of the people from the Nurses Union who's been at the leading front of all of this, and that's Michael Lighty. Michael is the Director of Public Policy for National Nurses United. Thanks for joining me again.
Thank you, Paul.
So the fight for this government health insurance plan, Medicare for all, whatever we're going to call it, has been a fight to a large extent against corporate Democrats. It's a fight. You're fighting within the Democratic Party to get it. You've now been able to pass it at the Senate, but even that was a major battle. In fact, talk a bit about how you were able to get that through the Senate.
Well, it is a fight within the Democratic Party in the sense that in California they have 2/3 of the legislature, 2/3 of the Senate, 2/3 of the Assembly, and a Democratic governor. So the political question for them is, are you going to let the Trump administration define what kind of health care Californians get? And Democrats do not want to say yes to that. They obviously don't want millions of Californians to lose the coverage they have, though it's not as good as it could be, nor do they want to lose the billions of dollars that are currently funding health care in California through the Affordable Care Act that the Republicans would take away if they succeed. So that context sharpens the debate, because there has to be an alternative to Ryan care, Trump care, if Californians are going to maintain their ability to even have what we have now. So our argument has been, you can't just solve that, you can't plug that hole. That's not politically viable, to simply ask Californians who have insurance to pay for those who lose it because of the Republicans' actions. You've got to guarantee health care for all in California. Now, the opposition says, well, it's not viable at the state level. How are you going to pay for it? We've got these issues. And you will not find Democrats who say, I'm opposed to a Medicare for all type system in California. I just don't know if this is the right time. I don't know if it's viable. I want to see what happens at the federal level. Those are all excuses.
Isn't there something kind of like it already in San Francisco?
Well, there is Healthy San Francisco. And that is it's an interesting variant, because what they do is they tax employers to provide funding for access to the public health system. And San Francisco has a very robust public health system. Clinics, community clinics, and a great hospital, San Francisco General Hospital. So anyone who's uncovered in California who falls through the cracks from the Affordable Care Act, is undocumented, or can't otherwise afford the coverage there, they're able to access the public health system in California as a matter of right.
In San Francisco?
In San Francisco. San Francisco residents, again, it's the parallel, right? So that is a good model, but it's not exactly what we're doing at the state level.
So describe the model, and again, what's the critique why it isn't viable? But what exactly is the model?
Well, the model is essentially get rid of the private insurance companies, replace this portion of financing that is currently privately done through the private insurance companies, where they rake in, $5 billion a year among them, as net income, and instead replace those premiums, deductibles, and copays with a broad progressive financing program that guarantees health care for all as a right. And that's the policy. And this is where we need to start the debate. The debate shouldn't be about financing or viability first. The debate should be about guaranteeing health care for all, putting providers, clinicians, caregivers in charge, and guaranteeing comprehensive benefits and complete access and choice of any provider you want. And those policies are what's driving our debate. The politics that are driving it is the fact that so many Californians, we estimate 36% of Californians are underinsured. They have a deductible more than $2,000 a year, and they literally can't afford to get the care that they need. So that's and then prescription drug prices, obviously escalating premiums, all those are driving the politics of it. And so ultimately Democrats face that choice.
And I would guess corporate Democrats would agree with everything you just said except the first sentence, which was you just went like that. Get rid of the private insurance companies.
That's right.
Except the private insurance companies are, I assume, funding a lot of the political campaigns of the Democrats that are sitting in seats right now.
That's what's funny, Paul, is that we have the state senator who voted for the bill whose list of donors is the entire health care industry, from pharma to hospitals to insurance companies.
How did you get
and he
this
voted
through
for the bill.
Senate?
It was inside outside. You know, we have a very good relationship with the Capitol. We obviously have, you know, we try to play the inside game.
In the Capitol.
In the Capitol.
Not with Capitol.
Not with the Capitol, thank you, in the Capitol. And, you know, we put forward the policy, we made a strong case, but ultimately we mobilized this grassroots army coming right out of the Senator Sanders campaign. Our revolution, what we call the A-Demers, those who took over the grassroots delegates at the California Democratic Party. We took all this, and then all the folks who've been working on this type of reform for really decades, since back in the 1990s. Healthcare for All California, obviously California Nurses Association, we're in the lead. And so you've got a nurses campaign with all these broad allies. The millennials who came up through Bernie's campaign, who are devoting themselves to this issue of Medicare for all at the national level, all of that grassroots pressure basically convinced the Democrats that their political future depended on pushing this reform and voting for it. And had they stopped it in the Senate, that would have, the impact politically would have been devastating to those.
And what's it look like for the Assembly?
Well, I think the political calculation is very similar. We also have to get the policy right. There's some still work to be done on the bill. But the politics of this are shaped by the reality that the California Democrats are either going to be responsible for the changes that the GOP do at the federal level, or they're going to come up with an alternative. And this is the only viable alternative.
And then it comes down to the governor if you get through the Assembly. And
right.
You think he'll sign this?
We believe he will. And we believe that this is good for his legacy. We believe that we will prove to him that it is viable financially, and we will prove to him that he can actually establish a standard for guaranteed health care for all that will, within, I think, a number of years, be the federal standard.
And what's the argument against the viability? California is about the same size as Canada.
Right.
And there's a system in Canada with that many people. Why? I mean, California is a country.
Well, it's ironic, of course, because I hear the California governor go around telling everyone that we can engage on climate like a nation, that we can lead nations on climate, that we have the resources of a nation when it comes to dealing with these issues. So I believe that's true of healthcare too.
Well, we were talking a little bit off camera about some of the critique. Couldn't have this bill been stronger? Right. The bill you helped write the bill as well, and your response was, but there's structural reasons, not just political reasons. About why? What are the structural issues?
Well, you've got 70% of personal health care expenses in California are paid by tax dollars. Most of those tax dollars are federal. For example, employers in California who buy insurance get a tax break worth $53 billion a year. Individuals get a tax break worth about $33 billion. The federal government is paying, I think in Medicare it's about $78 billion, and in Medicaid it's around $64 billion, if I have those numbers right. So you can see that's a massive amount of money. Overall, about $225 billion in our estimate is from the federal government, and we're talking about a program that in our analysis costs about $331 billion. So right now, you're looking at a huge federal contribution that we have to capture for Healthy California. And then, of course, you've got other federal employee programs, both for the military and other government workers. And you've got just and you've got federal drug pricing policy that presumably, controls, not entirely, but it's still primarily a federally controlled industry, right, the pharmaceutical industry. So you have these real structural constraints in a federal system where money and regulatory authority resides at the federal level. We have an approach that overcomes those, and in fact, the Affordable Care Act provides for waivers to states who set up universal health care programs that are either budget neutral and improve access. And so obviously we meet that criteria because we save money and cover everybody. So we believe that there is a strong basis for being able to create we channel all this money into one pot and then be able to pay providers in a way that's much more cost effective and saves taxpayers money. That's really what it comes down
We
to.
need the federal government to agree to this
Exactly.
transfer.
We need the feds to agree. And
so if they don't agree, is there discussion of some kind of a wealth tax or a state tax? It seems to me that the cost of what you're saying, $300 and some odd billion, is maybe, I don't know, 5 or 6 square blocks of Bel Air or Malibu. I mean, if you had a wealth estate tax, you would pay this off relatively easily here. I mean, not every state has the kind of money California does. But,
no, that's true. That's true. Yeah, and we've raised taxes on upper income folks. You know, we passed, in fact, the governor supported it, you know, initially, an upper income tax. So that is a viable strategy, but when you have to raise the money that we have to raise for this program, it's not enough. And you're right, if in fact the federal GOP bill passes, it's really just a tax cut for the wealthy anyway, so you'd want to capture that money. That couldn't fully fund our program. We're replacing private insurance premiums, deductibles, and copays, and we're relieving businesses of a huge burden. The irony to me, Paul, is that Charlie Munger, who's the co-chair of Berkshire Hathaway, came out for Medicare for All. Well, and he's the largest GOP donor in California.
Well, in Canada, one of the biggest supporters of the government health insurance was General Motors.
Exactly.
And in fact, it was one of the things that spurred more auto production in Canada versus the U.S. because of the cost of healthcare was so much less.
Yeah, don't tell the Americans.
All right, well, so what's the next big moment for this fight?
Well, we got to get, we're over in the Assembly. We passed the Senate, 23-14. A number of Democrats, when we say the Democrats didn't, you know, all of them didn't vote for it, they stayed off the bill. One voted no. Anti-labor Democrat from Contra Costa County. And so we've got to now go to the Assembly and move it through the Health Committee and their Financing Committee and then onto the floor with a financing plan in it, and that will take 54 votes. 2/3 of the California Assembly goes back to the Senate for concurrence and then on to the governor.
Any idea when that vote might be happening?
It has to be held by September 1st.
Oh, so not that far away.
Yeah.
All right, we'll stay on this story. Thanks very much.
Thanks a lot.
And thank you for joining us on the Real News Network.